Hello, everyone. My name is Francis Duenas. I'm a physician assistant student, and today I'm going to just share my thoughts on the case study that we have for the multi-generational disparities for our Hernandez family. So the three topics I'm going to touch on are the clinical medical topic, the generational focus topic, as well as the interdisciplinary collaboration topic. So starting off with the clinical medical approach or topic rather. Um, so the question I'm going to try to answer is how should care models adapt for the underserved multi-generational families such as the Hernandez family? And so one more one important way I feel like is a very adaptive approach is to shift the care models in terms of not simply adopting the care model, but adapting the care model and adapting it in the sense of a community-based approach, and community-based meaning specifically for the community that you're encountering. A lot of these models are built in a more broad sense for, say, for instance, Hispanic um, demographic, but then taking that model and then looking at your specific Hispanic demographic in your community and then adapting it rather than just simply adopting it. So, of course, a lot of these models that are already put in place have mobile bilingual clinics, or at least models or plans that you can adopt for bilingual clinics. Of course, taking these clinics, possibly even meeting where the families actually live inside of their community. Um, and this, of course, reduces barriers such as transportation. Transportation is a big barrier when it comes to just livelihood in underserved communities, of course, and let alone healthcare. Another approach, of course, or another, I should say, facet is to integrate the social determinants into the clinical care. So, um, a big part when it comes to the underserved community is of course their healthcare, but more so addressing the social determinants of their health. So the social disparities that they have and that they encounter on a day-to-day basis. That is that is arguably more important than their health itself. Because if you go back to what is it, Maslow's hierarchy of needs, uh, just going back to the basics of needs, right? You need food, you need water, and you need shelter, and then everything kind of after that, everything comes after that. And so if people can't meet those basic needs, then healthcare, they have, it's not important. So as a clinician or as a practitioner in the healthcare team, um, we must consider that it's very important. Otherwise, um, if we don't, then all of our recommendations and all of our efforts are left in vain. So that's one of the biggest factors is there's social determinants of integrating that into our clinical care. So screening is important for food insecurity, housing, addressing insurance gaps. Integrating our partnership as in different professions to address these social determinants, barriers, and then of course the being culturally sensitive and so being Spanish speaking, that's obviously a plus. Otherwise, having interpretation services or translation services on the ready if you're not lingual in the language that you're helping. Generational focus. So this is another area that I want to speak of is the generational focus, right? So how do health needs differ across generations? So every generation obviously comes from a different upbringing, different perspective. So that's important for every clinician, every healthcare team to think about. The grandmother, Elena, she deals with chronic disease, right? So approaching her care differently than, say, Rosa, which is a working adult that maybe deals with some chronic disease, but there's a lot of stress that she's dealing with, you know? So her healthcare and the approach with her is going to be different than the grandmother versus the generation below them, which are their teenagers. They're relatively healthy. So this is where we integrate more prevention, mental health, that sort of thing, integrating into their schools, focusing on nutrition, um, that sort of thing. And by attacking these generations in a manner where it's appropriate for that generation, could simultaneously break the any barriers within that generation, and that could ultimately break the cycle of the gap that we're trying to address in this activity that we have here. Okay, and the third one is the interdisciplinary collaboration. So of course, this is without being said. This course has been great so far in helping us understand, each and every one of us outside of our profession, understand the importance of our role, but also how our role is a singular role, and there's so much other special areas and niche areas out there that can provide assistance to support my role, as well as how I can support other roles, so that's huge. So role clarity, being honest about your role, being honest about your scope, and then also utilizing the resources, and learning about the resources or the professions that are out there at arm's length. So that way, by learning about them, you can utilize, leverage, and collaborate with those that are essentially trying to do the same thing that I'm trying to do, is help and improve health across generations, and with the family of the Hernandez family, of course. So, in closing, I just want to say health equity requires adapting, not simply adopting, but adapting these care models. And then, of course, tailoring our interventions to each generation. That's very important, right? And then leveraging all of the professions outside of my own scope, outside of our scopes, in order to create a sustainable change for all the generations that we are trying to help. So that's my 2 cents. I'll hear from you guys soon.